Dear colleagues, today we would like to report a very rare case of Apert syndrome. This kind of syndrome could be diagnosed in the third trimester of pregnancy. Look at this head of this baby referred to our unit in the third trimester. As you can see, measuring the biparietal diameter, you can look at his increased value respect to the occipitofrontal diameter. The shape of the head appears to be increased in the biparietal, so you can speak of brachycephaly. In this case, the cephalic index is above the 85 percentage. This kind of appearance let us suspect a particular kind of craniosynostosis. If you look at the cerebellum, it appears regular, and also the other cephalic structures. If you look at the atrium, it appears regular, and we are looking for the other cephalic structures because the suspicion of an Apert syndrome is connected to other kind of associated anomalies. For example, you could see the cavum of the septum pellucidum, so it could be excluded a corpus callosus agenesia. We would like to remember that this kind of syndrome is autosomical dominant. And now, if you look at the profile of the baby, you can see the bossing of the forehead, and also you can look at the nose. It appears quite small. So it's quite difficult to diagnose this kind of syndrome in the third trimester. Most of cases, they appear normal at the anomaly scan at 20 weeks. Now, as the operator is measuring the nasal bone that appears quite small, we need to look to other kind of associated anomalies. If you look at the baby, you can see the kidneys that appears quite bigger, but into normal range. In some cases, polycystic kidneys are associated to Apert syndrome. There's another measure of the other kidney that appears quite big, but in this case normal. In this fetus, we will not find any other associated anomalies to the Apert syndrome. The only one we found is the syndactyly connected with only one hand. Now they are measuring the bones, the long bones that appear normal. That's the ulna, the radio is normal as well. we would like to remember that it's very difficult, this kind of diagnosis in the third trimester, because the appearance of this syndrome could be very similar to a normal fetus. But if you look at an association of different things, like the shape of the head, the forehead, and if you look at the hands, in this case you can look at syndactyly, so the diagnosis of a Apert syndrome could be done. Look at this hand. The baby doesn't move it, even if we push with the probe a lot of times. And you can't distinguish the 5 fingers. Look at the operator. The sonographers try to make him move his hands, but he doesn't, so the diagnosis could be confirmed. But the last confirm need to be after birth, in which the baby could be studied also genetically. Look at this finger that appears quite indistinguished. In the neonatal life, the Apert syndrome is not very connected to neurodevelopment delay, but he needs most of times surgery for correction of craniosynostosis, and the prognosis depends on the associated anomalies. The placenta appear normal, but the amniotic fluid appear to be quite increased. In this case, we found a normal stomach, but in some cases we have some associated anomalies like agenesia of stomach or esophagus. Thank you very much for the attention.